Hello everyone. Today is Tuesday, May 23rd, and that is the date of my CT scan. And 2 hours before, I have to drink half of this bottle of yuck, and then an hour later, just about the time I'm ready to leave the house, I have to drink the other half. Get down to the doctor's office for port draw. I'll have to drink half a bottle in and then bring it with me, and the technician will tell me when to drink the final half. So this stuff is they don't even give you a marker where the half is, so we just gotta guess. Yuck. Okay, in another hour we'll drink the second half and then fly out the door and head downtown for my port draw, and then run across the street to Abbott Northwestern Hospital and do the CT scan. Well, it's just about 9:30, so it's time to drink the second dose of this stuff. Oh, yuck. Now that's a total of 9 grams of barium that I've drank so far this morning. Yep, it says recycle. Throw it in the recycle. And got my homemade cooler here to keep this cool, so it's a little more palatable. When I get down there at 10 o'clock, I've got to drink half of this, get my port draw, and then go over for the scan and drink the rest. So let's take a trip down to the Midtown area for my port draw and my CT scan. Well, I thought we were going to have to take back roads all the way because of accidents, but it does appear that the roads have cleared up and we're going to get to take the freeway most of the way down there. That's good. I just hate it when I got to take side roads the whole damn way. It's always way too close to rush hour when I have these appointments. This road's got a lot of cross streets that are uncontrolled, so I wouldn't want to die in a car accident.
My love and I took it down.
We're gonna get down here in plenty of time. Hello. Kenneth, not too bad. I guess I got a port draw this morning, 10 o'clock. Kenneth Kormendy. Okie doke. It's 10 o'clock. Time to take the third dose.
And we're getting some advice from a mid-morning pediatrician on winning the battle to get kids to do their chores during the summer. Well, it doesn't feel like summer outside today, but we do have a couple of nicer looking days in the forecast. Looking ahead, Wednesday, it's dry, 64 degrees. We'll warm things up a little bit. Thursday, though, looks pretty nice.
Well done. See, he can answer that quickly because he's hopped up on...
Yeah, we gotta get rid of this.
Morning.
I haven't quite figured out why they got me doing a port draw today.
What's your birthday?
3/19/51.
Looks like they want it prior to your visit. When are you back?
Next Wednesday.
Okay. Any scans or anything today?
Yeah, I got a CT scan coming up.
Oh, okay. What time's that at?
10 o'clock, or 10:30.
Okay. So I'll leave you access for that. If you want, do they use your port?
They got me drinking the barium. You know, it's not a PET scan this time, it's a CT scan.
Well, I can leave it in. If they don't use it, they'll just take it out, but
Okie
it
doke.
saves you a pull.
Yeah, I had no daughters available today. So this way, all we see is your beautiful hands. I didn't even think about putting that
Okay, man.
cream on this morning. That really doesn't make a whole lot of difference.
You don't think? Let's see with your creatinine. I think you should wait for your creatinine results, okay? To bring over to them, because it kind of depends where your how your kidneys are working when it comes to any contrast or anything like that.
Mm-hmm.
1, 2, 3. So as long as you have some time, I think you should wait. Okay, knew I was mad. Okay. Okay, come put your arm down.
Oh, you don't.
Sit up.
Sorry, it was so much trouble today.
It's not your fault, but I want you to wait in the lobby.
Okie doke.
Okay. As soon as that creatinine's back, I'll come get you.
Okay.
I'll give you the results.
Thank you.
To make everything quicker over there.
Look at my lab results. Time to head over to the paper building. Thank you.
So right now, what we're doing is, he's come and we're supposed to make it, yeah, he's been once.
Something I can help you find?
I'm going for a CT scan to, I think it's radiology
Check-in?
check-in.
Yep, that's pretty cool right down here.
Okay.
Welcome to our labyrinth.
I've been here before, but I had to come from the Minnesota Oncology through the...
Nothing looks familiar, does it?
Nope.
Just call your family. You're not in the waiting room, okay? All right, thank you.
Any restriction, flight?
No.
No, okay.
Radiology registration.
Yep. Yep, they're gonna be the double doors just down here on the right.
Yep. Well, got my lovely wristband on now. That was exhausting. Dookie.
I'm gonna check your name band here too. This one?
This one.
All right. Come with me. Let's see. You're dressed for the occasion, I guess, huh? Come on.
Yeah. I normally wear bib overalls.
Questions, okay?
Okay. All right, have a seat right there. So we're gonna be doing a CT of your chest, abdomen, and pelvis. That sound correct to you?
Yep. You look like you could be the sister of one of the girls that works over at Minnesota Oncology.
You know, you're the third person that's told me that. I apparently have a twin over there, I guess, huh?
Yeah. And very, very similar facial features.
That's funny. Well, one of these days I should just walk over there and see what she looks like, huh? So what's the reason for today's test that you're aware of?
Checking the progress of my cancer treatments.
Have you recently completed treatment?
Yeah, I just had chemo last Wednesday.
Okay.
No.
No?
The small scale is still was taken. The last one was sequoia or something like that. Cancer.
Do you have any kidney problems that you know of?
Okay. And have you already had the microwave? Is this
Had the
following?
microwave and then operated on after that. Took part of it out with Dr. Great job.
Okay, so this is a follow-up to see how it looks after all the surgeries?
Do you take medication for high blood pressure?
No.
The
Sounds good.
first of
Any
many,
breathing
I think.
problems or asthma?
No, just some congestion with chemo.
No, I just didn't want to do this small cell again. I'd already done that one.
Sometimes it clears up. Sometimes I'm hacking my head off all day. Just never know.
You are diabetic, correct?
Yeah.
Do you take medication for that as
Yep.
well? Have you been through radiation therapy as well, or just chemotherapy?
Just chemo.
Do you have an overactive thyroid that you know of?
Nope.
Any family history of kidney failure?
Nope.
Do you take ibuprofen daily?
No, just when I need it.
Do you have scleroderma or lupus?
Nope.
Ever been a smoker before?
Yep.
See, that's a loss of your barium, I take it in there,
Yep.
right?
Keeping it cold.
Yeah.
Those are homemade can coolers.
Any problems ever with the contrast dye?
I like it.
Any allergies?
They
or
work.
reactions to it? Any kidney problems you're aware of?
No.
Heart problems?
Do you have a port?
Yep.
Yes.
High blood pressure?
It's in there.
Is still
Breathing
accessed
problems like
from
asthma,
across the street?
Yeah.
Okay.
They did
Some
a
emphysema. and-
cord draw this morning.
Oh, yeah, I suppose that's...
But maybe that's what they took out.
It was stubborn.
It was. Well, I just want to make sure it's still in there properly and whatnot, so want to make sure it didn't get dislodged or anything. Well, you only walked over here, I know, but just to make sure we're good. Alright, I'm just going to put a different cap on this end, and then we'll be good to go. So, 1 second.
Have you had any chemo or radiation treatments?
After this test, you need your report for anything else?
No.
The radiologist wants to know, it doesn't have to be perfect, the last time you had chemo.
Oh, February 2014.
Okay. How about radiation?
Alright, so you can come with me. Just around the corner, back in that waiting room. They'll come get you in just a moment, okay?
Okey-doke. And now we wait some more. Well, we're running a little long. It's already 10:56. Not into the CT scan yet. That's me.
That's you, yeah. What did you do any of the lights on? Good morning, a new fixing, like a perky fix.
Oh, excellent.
Right around here, how you doing today?
Oh, not too bad.
Good.
Definitely getting a workout.
You taking pictures here?
Yeah, it's we decided a few weeks ago that we're gonna document the rest of this trip through cancer.
Oh,
My daughter ran the camera through the chemotherapy session.
Oh, she did. Okay.
Didn't have anybody come with today. It's not such a big deal doing a CT as far as the kids wanting to be there. But
Oh, that's kind of nice, though. I mean, nowadays you can capture everything. Nice. You can put your things there on the chair. It looks like you got a nice setup for your oral contrast there. You all done drinking it?
yeah, well,
Should be a little bit left.
There should be.
Yes. Looks like everything. You're dressed for the occasion.
Take all the stuff out of the pockets.
Making sure you got everything. You know, I see it on my scalp pictures if there's something there anyway, so. Yeah, just if you want to just put it on the chair there. Should put hooks in the rooms.
The only other thing I got is car keys.
You gonna drink your little bit there?
Yeah. Well, I was
Just a
told to
few
wait until I
swallows.
was told.
For your stomach. And then I'm gonna check your name down here too.
Yeah.
Good. Okay. Sue, if you take this way to sign, I'll go and relieve Kim.
Sounds good.
And he might be filming you a little bit. She's much better looking than I,
Oh,
so.
wait a minute.
It's aimed at the bed.
No, he's just documenting
Oh,
his
got it,
Yeah,
okay.
it's been in there for like an hour and a half.
You know what? I thought it looks like a radioisotope
It
there.
does,
Makes me a little
yes.
nervous. You don't have to drink the whole thing. Just get a few swallows down, okay?
All right.
He's good to go then. I'm turning you over to Sue, and I'm going to go relieve someone else. You scared me away with the camera. No, I'm just kidding you. Just kidding you. All right.
Okay. So, are we doing IV contrast here, or are we not doing IV contrast?
They left the
Poured in? Okay. Here it says no IV. Oh, if it is, but it was good, so we're good with the creatinine. Labs came back perfect. 0.7 creatinine and over 60 GFR. We won't inject if it's under 50, so you're over 60. Super good. So
you'll be taking this thing out.
the nurses will when we're done. Yeah. So we're going to use that to put the contrast in right now.
Okay.
And you've done the oral, so we're going to get you on the table now, okay?
Okay.
I'm going to double this pillow up. It's kind of flat. I'm going to have you sit here. Your head's going this way. Your feet are going to hang off the very edge. I'll put a cushion under your knees, okay?
Okay.
So you've been through this before, have you?
The last one was a PET scan.
Okay. You remember about the hot flush feeling when it dilates the blood vessels, gives you a hot flush feeling as it goes in?
I don't know about it.
Okay, all right.
I had this little before a stroke, so
Okay.
you might go ahead and turn out not to be a stroke. I have some extra ones and full ones.
Okay, thank you. All right, so head this way, heels that away. Very good. Right in the middle, perfect. Come on down, I got that doubled up. I'm gonna have you bend your knees up for me too. I'm gonna put this underneath, that'll make it a lot easier also. All right. I'm gonna get you up. Take the seatbelt away, you don't look like you're gonna jump off the table. Don't prove me wrong now, okay? All right, so we're gonna clean that port with a little bit of alcohol here. And I'm gonna attach you up, okay? This one is I'm going to ask you to put your arms over your head for me if you can. Beautiful. Excellent. The other thing I'm going to do
Yeah.
All right, I like it. All right, Kenny, here we go. Just getting our pictures first. Here we go.
Breathe in. Hold your breath. Breathe. Breathe in. Hold your breath. Breathe.
Hey, Kenny, here we go. I'm going to put a little saline into that IV right now. Good. Feel good on your end? All right. Next is going to be that contrast. Now, this is that stuff that can give you that warm, hot flush feeling. You may or may not get, okay? Good scan to the chest. Then it's going to pause for a few seconds and then jump into the abdomen pelvis, okay? All right. Scan for approximately 20 seconds. I'm going to get back on my machine. Here we go.
Breathe in. Hold your breath. Breathe. Breathe in. Hold your breath. Breathe.
You can rest your arms down. I'll be in a minute. You can rest your arms down, Kenny. I'm just going to check our pictures, okay? You want to rest them down? How was it? Not too bad? Good. You did a little bit of my I know, isn't that that's what. Okay. I'm gonna just leave you on the table until I can make sure I did a good job on mine, and I'll be right back, okay? You're still pretty far off the ground, so I'll be right back in a minute. All right, they turned out beautiful. Turns out you're very photogenic, so like that.
So I will walk him back.
Okay, he's got a port, so we need to.
Did she take that? There was like a.
The stroke one, she told me to use it, so.
Oh, that's what it is. It's a carotid.
Right, okay, I'll go out with another one. All right, let's get you sitting up here. Yeah. This one let you sit for a few seconds, so I get your bearings before we move you out of here. What are the plans for the rest of your day now?
Oh, got so many things to do.
Yeah. You got a list.
After I get home, I'll think about it.
Okay, all right. Time's gonna take you out.
Go get that porty access.
Yes. So you can get out of here. I'll just open the door for you.
Oh.
You look comfy.
Yeah, I'll be glad when it's warm enough where I don't have to wear something like this.
Yeah, I agree.
Get one nice day and then,
Well, we do live in Minnesota, so we should expect it, right?
Yep.
We'll grab one of the nurses to de-access your port.
Okay.
See right there, I'll let Tina know that you're ready to go.
Okie doke.
Hi.
Hello.
I'm Tina. I'm one of the nurses. We met earlier.
Yeah.
Okay. So, I'm gonna flush your port with heparin.
Mm-hmm.
Any trouble ever with heparin in the
No.
past? Okay. And then, I'm gonna use a Band-Aid. Any allergies to Band-Aids? Okay. Good. Let me just see your wristband you have on.
It's hiding in there somewhere.
It sure is. Yes, sir.
Not a problem.
Okay, I just need some gloves. What's with the video camera?
We're documenting my trip through cancer.
Gotcha. Well, how am I doing?
Oh, I haven't even, you want to say hi?
No, as long as I don't have to, I don't want to. I thought you were recording our conversation.
Well, they can hear you, but they can't see you.
Ah, gotcha.
They're looking at my port right now.
Perfect.
They're going to see your lovely hands.
Oh, and they're covered in purple gloves, too. They're going to see how compliant I am with all of the appropriate protocols. Do you live around here?
Bloomington.
Okay. That was a saline.
Mm-hmm.
This is the heparin. Okay, so we're going to do a tape pull. Okay, and then out it comes. Be right back. I'm going to put this in the sharps. Okay, you are set to go.
I thank you.
Thank
You've
you.
been a pleasure.
Yep, you too.
So you just out this way?
Yes, sir, you got it.
Okay, it's Wednesday morning, May 24th, and now I get to go back into Minneapolis Midtown and see the oncologist and find out what he has to say about the results of my scan yesterday. The things I learned yesterday is no matter what they say about calorie intake while on chemotherapy, trying to get over this cancer, I've got to start dieting a little bit. I've got to watch what I'm eating a little bit more. It's difficult to exercise because the chemo does zap energy from you, and you notice I was huffing and puffing and had some long walks yesterday, and I could tell myself that, and you could probably see it in the video, I was walking with a distinct limp because of the numbness in my left leg and foot. And it seems to get better with loss of weight. And I could just see I've put on 31, 32 pounds since I bottomed out. And I think it's all gone right in the middle here. Because I know that when I was starving, couldn't eat, I was losing muscle mass. And I think the weight I put on is all fat. And that's not good, so I've got to start cutting my caloric intake, eating a little bit smarter, try and get so I can start moving again, because I am really getting winded way too easily. I've got to get my weight down so I can move more and start walking. I don't know how much I can walk with this problem with my left leg, but I've got to lose some weight. We'll find out more of what I'm looking at when we see the oncologist today. Let's get moving.
Hi.
It's me again. Kenneth Kormendy, 10 o'clock, Dr. Larson. Thank you. Hello.
How are you doing today?
Pretty good.
Good. What's your date of birth?
3/19/51.
Thank you. Who screams at you?
What's that?
What was it?
Well, when I was on the feeding tube, you know, they say just eat everything you can. You know, you need those calories to fight this cancer. And now that I put on 31.5 pounds, I said, no, we're going back down a little.
Any pain right now?
Nope.
Changes in your medications since the last time you were here?
Nope.
$98.5. Can you take this off?
Yeah.
$152/70. Top number just a little bit higher, bottom number is good.
Well, this is the second time I've met you, so it's lower.
Lower than last. Yeah, it was lower than last time too.
I had the joke that you had my lower number up last time.
Oh. All right, I will let the doctor know, and he'll be here shortly. Okay.
Okay.
Thank you.
10:20.
Ken! How are ya?
Not too bad.
Am I on the tape?
You're on SD card.
What's that? What's that?
Well, cameras used to use tape.
Oh.
Now they use SD cards.
Okay, so you're here today for scan review.
I guess.
Are you feeling good?
Yeah, it's a little tuckered after yesterday. I did a lot of walking.
What'd you do?
Well, I had to park way away and walk in here, and then went down through the basement, probably halfway through the hospital before I found an elevator going up. And
Oh,
clear on the other side.
you were here for your scan and
Yeah.
such. How's life at home?
Okay.
Good? Okay. You're not due, this is just an interim visit. You're not due for cycle 11 yet.
Nope.
I think he's gone next week, so we had you just come in for the scan review, and we'll schedule your chemo next week. How's that? Due for cycle 11, let's see when. Not until
Should be the 31st.
31st. No one's with you today. Usually you have someone with you.
No, I can't have the kids take that much time off work.
They probably don't mind.
My youngest one, Sherry, she used like sick days and vacation days. And my daughter Amanda, I don't think she has any right now, so when she takes a day off, she's just losing the income.
No fevers?
Nope.
Any chest tightness or pressure?
Nope.
Let's see. They didn't do another echo. You're not due yet, I don't think.
We had one last month, so.
In April you had one, so. Okay. Any pain?
Nope.
Nausea?
Nope.
Vomiting?
Nope.
Mouth sores?
Every once in a while I get a little in the corners of my mouth, but
Overall, it's
just
okay.
very slight.
Okay. And any increased shortness of breath, or is it the usual?
Well, I was pretty winded yesterday. I was breathing pretty hard.
Because
after
you
all
had
that
to
walk.
walk.
Yeah, a long
So with activity, you expect that, but on a whole, is it any worse for the wear day to day?
No.
Okay. Cough? Still have that?
Yeah.
Is the phlegm still white or is it?
Yeah, it's just
Okay.
kind of white to clear.
Okay. Constipation or diarrhea issues?
Just borderline, but never.
Well controlled. Neuropathy. Any worse for the wear?
I think the left leg is getting worse. I was walking with a very obvious limp yesterday and attention, but when I was looking at the camera, I said, boy, this guy walks funny.
Are you still like working during the day? You're
Yeah,
farm, right?
I'm not. No, I've got a taxi limo dispatch business, and so
Oh, that's
that
right.
doesn't give me a lot of physical exercise. And any exercise I get is chores around the house or walking through a store doing shopping. That's my big exercise, and I gotta start doing more, and I gotta lose some of this weight. I think when I lost all that weight when I couldn't eat, it was muscle mass that I lost, and I think all the weight I put on is all right here.
Sounds about right.
And I gotta take
Anybody
some-
over 45, I think that's what the routine. Quality of life? Your quality of life, is it good?
Okay.
Okay. Acceptable?
Yeah.
Okay, so today, he's gonna review the scan. We're squeezing you in, so it might be a little speedy on the visit. You're due next week, so do you have that appointment already scheduled?
I think I do.
And then, let's see what you've got scheduled, so.
I think it's like 10 o'clock on
Yes, on,
Wednesday, the 31st.
yep, you have your treatment then. Still gonna have to get you your next appointments. We'll do that today. Put orders in for, you're gonna be due again on mid-June, okay? And I think we should probably do a lab on to CBC for chemo. All right, Ken, he should be in really shortly. Okay?
Okay, doke.
All right, good to see you.
Bye-bye.
Hey, have a good long holiday weekend. Do something fun.
10:34.
Hello, how are you?
Hello.
Oh, Ken. One patient before you, and we'll get you taken care of, okay?
Okie doke.
All right. Look at your camera.
Well, that's 10:37. We're getting closer. 10:41. 10:47. 10:52. 10:58.
All right, here we go.
Keeping me in suspense.
Yeah, sorry. No, there's nothing here to be frightened of. Frightened about. Looks like the results are good. No signs of growth anywhere. Kind of looking for anything worth even mentioning, actually. Because they often, as they pour through all the pictures, they comment on this, they comment on that, and not really a lot. You know, for example here, diverticulosis, outpouchings of the colon, and degenerative changes in your spine, things that are wear and tear and are really medically relevant. You got some plump nodes along your aorta. These have not increased in size, they're the same as always. They might be involved with the cancer there, but they're not growing. So, all appears pretty well. And looks like you've had a couple echoes. The last one in April looked good. The heart is still squeezing pretty strongly. And your blood tests only show that your blood sugar is up.
Yeah, it's in the last week and a half or 2 weeks, I bumped my Victoza up by from 0.6 milligrams to 0.72, and I think when this pen's done, I'm going to bump it up to 0.78. I think that'll also help me keep my weight a little more in line. It's getting too high.
Oh.
Because when I lost the weight, I think I lost muscle mass as well. And
Yeah.
putting it on, it's all going on down here.
Oh, instead of muscle coming back, it's more fat coming back. So I was going to say, I could always give you some rotten chemotherapy, I'll make you lose weight. You don't want to do that though. All right, well I think we should probably keep up with what we're doing. Let's see if Sarah had anything here. No, she said that you still have the neuropathy, of course.
So long term, are we gaining any ground or just holding?
Yeah, so the idea is initially to shrink things and then thereafter to keep them put. As long as, I mean, if I could keep your scans looking like this, you'd live forever like this. It would require the treatments at some interval to, maintain that. The unfortunate truth is that most of the time, almost all the time, at some point the cancer will grow again. That whatever herbicide I'm laying down on the field of your body, after a while there's resistance that some of the clones start to grow and then they'll become the dominant species and we'll have to switch to something else to try to stamp it underfoot again. But for now we're doing good, and like I say, if we could
We're just holding our own right now.
Yeah, just holding our own, treading water, and hoping that the day where it no longer does its job and is as far away as possible, so kind of the biggest hope at the moment. I guess the other thing I hope not to see is that your heart get weakened by the Herceptin, at some point. You wonder if we'll have to drop that drug if we see the heart starting to suffer or something like that.
Mm-hmm.
If in the course of things you say I could use a month off or 6 weeks off or whatever, because I got some important things I want to do, that's okay too. We can take chemo holidays, we call them. So that's okay. Looking at your scans, it's hard to really see anything that's wrong with you. I do it. Just scrolling through the pictures today.
So we could basically take this next one off and just wait another 2 weeks after that and kick it back in. I think that would be good because my kids could use the time off and I could use the time to concentrate on business.
We're happy to do it. So you're here today, so do I understand you are, but it's a little bit early, you're probably coming in early for me because I'm going to be out of town, is that right? So the question is, do you want to do this next one on the 31st or just hang on and push that one back?
Why don't we just skip that 31st and then go 2 weeks after, what would that be, the 14th or 13th?
I'll do it right now and see what it shows on the calendar. So that's the 31st, so I think it would be 13th. Does that work for you?
Yeah.
Okay. All right, well, I should take care of that for you, huh?
Yep.
About any questions or any other concerns?
Not really. Just really kind of anxious to know exactly what we were doing. And
wondering if the other shoe was going to drop today.
Yeah.
No.
If I heard it was growing or if it's not shrinking at all, just staying there. So is it basically the same size as it was last scan?
Last scan, it's unchanged from that. And see, it wants to go further back to find out. It usually shrinks at the outset, and it might shrink once or twice, and then it stops. It just stays put at what I call a plateau. Let's see, first therapy is just look here. All was way back, the good stuff, the oxaliplan. Sorry.
It wouldn't be so bad, this time of year, but it's still it eliminates the cold stuff.
Oh yeah, you're not the first person. That's quite understandable. So let's see if we go back to so December 7th you had a scan, and then let's see, you had another one done. It looks like you might have a PET scan in between here.
Yeah, I know there was a PET scan.
Around about the March.
Yeah.
Here we go. So things have gotten smaller there. Some of that we can tell from the uptake of the stuff unique to the PET scan. Because size-wise, had improved too, but you can see the the hot stuff going away, just the color changing to a more normal color, not just things getting smaller, but that too. So I think that it's likely that you'll, hopefully, the pictures will look like this again and again and again, knowing that at some point things will get worse, and we'll have to have a conversation about things like treatment may not be helping us out. We've got to think about what more we want to do at this juncture. There'll be options. Second line therapy, we call that. It'll be a conversation, about trade-offs and side effects. And
are there any natural things that can be taken orally that can help?
Not that we know of, nothing that we could point to. Otherwise we would use them. But some of the chemotherapies, not what you're on at the moment, but some of the other chemotherapies are derived from plants essentially. And they're just concentrated and injected and what have you. So this one here, they're not comparing it to the PET scan, they're comparing it to the CT scan actually from December. And they can see that your swelling around the esophagus is smaller now compared to December.
Yeah, I couldn't swallow anything back then. I mean, I went without Thanksgiving dinner and I went without Christmas dinner.
Hopefully it'll be better this year. Or anything else I can do for you?
Nope.
All right, I'll have you come back, and we won't even need to see you. Just come in and see us on the. We'll have you, if you don't mind, stop by the desk to schedule your June 13th visit, and then we'll see you the one after that.
You want to schedule that at the desk?
Yeah, I'll put in the orders.
Okie doke.
Good for you. Keep it up.
Okay.
Thanks, man. Have a good day.
So I am taking a little vacation from chemotherapy and hope it doesn't do any damage. Well, I'm back home from the oncologist's office and had time to think about what he said. And you basically heard what he said, that the cancer is not going away. It's not getting bigger right now, but eventually it's going to. And it's just a matter of how long we can hold it at bay. And I think positive thinking helps. I've not felt like a man who has a terminal illness at any point since this whole thing started. And I think that helps me. I know the chemotherapy has taken some toll on me, and I'm getting a little weaker. I don't have quite the lung power and the endurance, and I need to look at trimming my meals some. I got to lose some of this weight. I saw in the videos that I took yesterday during the CT scan, the weight that I lost was a lot of muscle tissue as well as fat, and the weight that I put on I think is all fat, and I've got to get more exercise in. It's difficult because I get winded pretty easily, but even looking down a endless tunnel, I still need to keep myself in shape. And I think getting myself in a little bit better shape is going to help me feel better and deal with this better. And I think it can only prolong my life and make what quality of life I have better. And when I got home, I did call my youngest daughter and talk with her. And she had a little difficult time with it. She wanted to hear that the cancer is shrinking and going away and I'm going to live forever. But the truth of the matter is, I'm eventually going to succumb to this cancer. I'm hoping to hold it off as long as possible. Do some more things along the way. Try and enjoy what time I have. I love my kids, my grandkids, and my great-grandkids. I've got three great-grandkids, 5 grandchildren, and 3 great-grandchildren, and they are beautiful. I want them to know their grandpa, And so I'm just gonna continue to work on it. What spoke with the oncologist. I'm taking this coming chemotherapy session off and getting a couple week break. So it's actually going to be almost 4 weeks in between sessions this time. And that'll kind of give me an idea of how the chemo is affecting me. Once I get past that 2-week mark, am I going to feel better for a while, or is my congestion going to get better? Because the cancer, it works on rapidly dividing cells, and hair follicles are rapidly dividing cells. That's why so many people lose all their hair. I guess I'm not getting that really nasty drug that causes all the hair loss, but it has caused my hair to really slow down and thin out. And I had nasal bleeding because you have a lot of hairs in your nose, and it was killing those hair follicles, and that's why I was getting a lot of sinus bleeding. I didn't have a bloody nose, but when I would blow my nose, you could see the red in there. And I think it's doing the same thing. You've got hair-like things in your lungs that move, and the cancer cells or the cancer treatments are going to affect them as well. That's why I've got a lot of congestion in my lungs. And I'm hoping that gets a little bit better and just gives me a little reprieve from it. The end is probably no more than a couple years down the road. I'm hoping, for at least another 2, maybe 3 years. May not be anywhere near that long, but that's what I'm hoping for. That's what I'm shooting for. And I'll do occasional update videos to let everybody know how I'm doing. And for those of you that are going through this yourself, you can see how it affects me. I watched this video of a girl from, she's from Mexico City, but she's living in South Korea, and she has esophageal cancer and just did her first round of chemotherapy. And I tried to give her some words of encouragement, but I was just heartbroken watching her video because she was so sad the whole way through it. I don't want to be sad. I want to keep living life. If somebody tells you you've only got a year or 2 years to live, is it worth being depressed and being down for that remainder of your life, or do you want to smile? And I want to smile. I'm not done smiling. In a way, it breaks my heart, really because of what my kids are going through. They're looking at the fact that their dad's going to be gone. My youngest daughter, she hasn't had a real good life. She married the wrong person, and he was a user, and completely trashed her credit. And he even did a number on her health. Idiot crashed a car and gave her a back injury and twisted her arm to take a cheap insurance settlement where she couldn't come back and get any kind of future compensation for her back injury. And I've hated him ever since that day. I hated him the first time I laid eyes on him. He's a user, and she needs better, and I've helped take care of her. And I think now she's looking at the fact that, can I get my life in order before Dad dies? And I'm going to do everything I can to help her along the way and get her feet on solid ground before I pass on. And there's just a lot of things to think about, but I don't want to think about a lot of things that are going to pull me down. I just want to think about the things I have to do and the positive that's going to come from the things that I have to do. You know, that's where I am right now. That's my mindset. I'm not gonna get down in the dumps and cry, oh Lord, why is this happening to me? I know why it happened. I didn't eat enough vegetables when I was young, or as an adult. And it turns out not getting enough vegetables is a key reason why people develop esophageal cancer. So parents, show this to your kids. Let them know this is one of the reasons why you have to eat vegetables. You can develop esophageal cancer by not eating enough fruits and vegetables. I want everybody to know that. I don't want anybody else to have to go through what I've gone through. I know that, you know, I smoke, probably might have contributed to the cancer. It did not cause it. This is adenocarcinoma. That is not caused by smoking. This is a glandular cancer, but it may have contributed to its growth. And I still have not quit. I'm trying. I think today I'm going to look at going back to vaping. I tried vaping once and it wasn't very, I don't think I had the right equipment. And I'm going to see if I can find something a little better that that'll also save a lot of money. And I've got to prepay for a funeral, and that's money that could be used to pay for that funeral. So I know it's coming. I just want to hold it off as long as I can. I do airgun reviews, and the people that are following me on my airgun review channel, which is my airgun reviews on YouTube, and the same on Daily Motion. I mention Daily Motion because I get more revenue per 1,000 views on Daily Motion than I do on YouTube. I just don't get enough views on Daily Motion. The more people that view me there, you know, the better off I'll be. But I'm going to try and continue doing these reviews and keep my viewers happy doing that, and just try and take care of myself and keep my thoughts positive and live as long as I can. Don't know how long that's going to be. Hopefully it'll be a long time. I'm not giving up yet, but that's where we are right now. And yeah, if you've reached this part of the video, you're a dedicated watcher, and I thank you. I know a lot of people have only looked through part of it and typed that. I really want to thank you from the bottom of my heart for sticking with me this far. I love you all. Take care, and I'll be in touch. My name is Kenny Kormendy, and thank you for watching.